Welcome, ladies and gentlemen. This is Dr. Farhat Asif on behalf of SILKROAD 4.0, Diplo TV, the Diplomatic Insight. We are here another episode of an interview series conversation with another amazing leader who will be participating in our future summit happening on 29th of November, 28th of November. Yes, 28th of November happening across the world. We'll be participating in this important summit where we'll be discussing about AI, future of the world. Today, in this interview series, I've been joined by Steve Dimba, who has been dealing with digital health and diplomacy and how the use of the technology is important and how these future various technologies that we are using in our well-being, in human well-being, why it is important. So we'll be discussing with Steve. Welcome, Steve. Thank you so much for joining us for this conversation. Two friends.
Thanks, Dr. Farhan. A pleasure being here.
Okay, wonderful. Thank you so much for joining us. First of all, let us, Stephen, begin your journey, your passion of the work that you are currently doing and leading. And I would like to ask you that as a young man growing up in Kenya, your home, your place, such a vibrant, environment that you lived, your teachers and your who have shaped you who you are today. And when you were young, what are Stephen's own inspiration, what he was looking for, and how the journey was looking like when you were young, and what led you to be what you are today? So, Stephen, your journey.
Thanks, Farhat. It's nostalgic when you ask me about my journey because it's been a roller coaster of events and so many things fused together. So I was born and raised in Kenya. I was privileged enough, let me put it that way. I've grown in a rural setup and an urban setup.
Mm-hmm.
So I always say I'm a child of both worlds. So when I was young, I grew up in a rural setup where you interact with nature, less technology, but everything in its native form. Then there about when I was like around 10 years old, now we moved to an urban setting, and that's where my urban lifestyle began. So I always say those two kind of fused on what I do today because I understand how the rural people live, the constraints they live within, and how they survive. And in the urban setup, the challenge people have, the advantage they have, some may not know they have an advantage, but also what privileges do they have at their disposal that somebody can use to their advantage. So growing up, to me personally, I was a curious child. Let me put it that way. I'm one person who used to break things and fix them. And my dad used to ensure that when he buys a new gadget in the house, he'll keep it safely because tomorrow I will break it and try to fix it. I was that curious child. So maybe that's the engineer in me was being molded without knowing. But so along the way, I always ask myself, any instrument or any guide or any technology or anything that brought to me, I always ask what's behind it. So I'm always curious to understand the rationale behind it. And I think that curiosity is what has carried me up to today. So whenever something's presented to me or I see a new thing, I always ask myself, so what's behind the scene? Can I be able to unravel it? Then I can understand this particular issue now better. So basically, that has been my journey. So I'm a child of both worlds, the rural child and the urban child combined together. Yeah.
Yes, it's such an amazing world. I mean, you have connected both rural and urban world. I think that both are interconnected and they're intertwined and has shaped you who are you today. You have spent over 15 years of your lifespan focusing on healthcare, fintech, and consumer market across East Africa, and which has led to what you are dealing with. So I would like to ask you, was the turning point that has led you to realize that technology is the solution, or that can redefine the healthcare in not only rural Kenya or region where you are operating, but also the urban environment as well? Because these are things that have also led to us to drive a change. And I see that you had been transformative in your approach while you were young, or you were looking at the technology as a solution builder?
Thanks. One thing that has remained constant in my understanding when I look at the rural lifestyle and the urban lifestyle is everybody has challenge in access to healthcare. And the system was designed specifically for brick and mortar a framework. So that means access to healthcare is hampered by geography, it can be hampered by cost, it's hampered by stigma because you walk into a public facility where everybody sees you coming and maybe your ailment is in, and you wanted like if it's a psychosocial thing, you wanted that kind of cover so that you can be able to talk to somebody discreetly. But that's so stigma makes people not attend or go to those brick and mortar facilities, and also just fragmentation of services. You have to move to one block to another block to another block to access myriad of services. So all those combined provides just bottlenecks to access to healthcare. I can just give you an example as I interact with people. So I remember around 2015, I was doing I was recruiting merchants to a mobile money framework so that we can be able to give them credit for using the digital finance framework. Now, I was recruiting pharmacies in a rural area. Let's remember, just outskirts of Nairobi, town called Machakos. Now, while we were discussing with the pharmacy owner on how our product works, because a very basic product runs on USSD. Now, a mother walked in with a sick child, and from the conversation, she had walked like 2 hours to that pharmacy because that was the nearest health facility that was close. And from the discussion, the consultation, if it was on phone, it could have just taken like 5 minutes and the solution will have been availed to her. So to me, that was like a bulb moment being created, like, hold on, there's more to meet the eye than what we are seeing here. It means the technology can be able to be used to provide bridge so that all these constraints I've just talked about in terms of geography, cost, and the rest, technology can provide a democratization framework whereby it's a unified platform, and all those people who are having a challenge accessing this healthcare can leverage and take advantage of it. So healthcare isn't complex per se, or I can say how it's been designed wasn't designed with urgency or wasn't designed with creativity in mind. It was designed for people who are you need to be physically present for you to be able to enjoy. And now technology is coming to smoothen those bumps that have been there. Yep.
Exactly. I think that sometimes we get scared of technology. When technology revolution happened across the world, people get scared. People thought, oh, my jobs will be ending, or what will happen, or whatever. Whenever there's a change, always people get scared of it. When you look back, what are the most experiences that you have had that shaped your philosophy, your approach towards your leadership, and transformed the way you look at handling the situation? I would really like to know about that as well.
I run with one philosophy in life when you're designing technology. I always say, design for scale, but adapt for reality. Like, design with scale in mind, but adapt to reality on the ground. That's always my mantra. And this is critical because every place that you go, you'll have designed something, but the reality on the ground gives you the real true feelings that your technology need to adapt. So that human behavior, naturally, if you bring something that is new, first thing is always to resist. That means, how do you reduce this barrier to entry to the nearest 0 point by making that technology infuse in their natural behavior, so that now resistance becomes low. And to me, that's always the mantra I look at. So first, I understand the human behavior. Is it culturally? Is it that particular setup? And then the technology that I will bring on board will fuse into that behavioral framework, so that now adaptation and trust building. Because remember, in healthcare, core component of a fundamental thing in healthcare is trust. So how do people trust this new technology? If it mirrors their normal way of of living, it becomes easy for them to be able to trust. And lastly, they need to see a human element to it. It's not just technology, but a human element at the end of the day. If using technology, but I'm seeing a doctor, either I'm talking to a doctor or I'm saying it's a video call, I'm seeing a doctor, it provides now that ultimate trust that is critical. Yeah.
And this is something that you had built your path on, and of course, finding solutions to the real issues for the human life. You have also co-founded Klinik, which is again a platform that you're providing a solution to. Can you also share with us what are the gaps that you see that at the human level, as you're saying, is a solution that Klinik is providing, and how you are envisioning this to be the platform for everyday families to get connected to and finding the solution? Please share with us about that.
Thank you. If I get you right, human elements of anywhere in the world are normally focused on three things. And to me, as Klinik, that's where we really put our really strong resources on. So human elements normally look at three things. How is it to access that particular service of the technology you're bringing to them? Number two, does the technology offer them dignity? That's very critical for human elements to be able to adopt. And lastly, as I said, trust. Do I trust what you're bringing me? So if I can bring it down, for instance, a 19-year-old boy who has, let's say, challenges, mental issues, will use your technology if they are comfortable. The uncertainty, the anxiety they have will be managed in a dignified manner, less with stigma. So that means I'm speaking to somebody discreetly. My friends will not know unless it's me who tells them. So that means, because at that particular stage, they are really focused on how people view them, and they're really conscious, in fact, 100% conscious on what the world talks about them. So that's one thing. How do I bring that dignity to this particular kid? So if they are having, I can be able to tell them, you can have a counseling session with a certified therapist on this platform, and your information will be discreetly kept because we abide by the laws of the land, data protection, GDPR, and the rest. And they try it out and they see, actually, from the discussion, they have been heard. For once somebody has heard about them, hasn't judged. As the youth normally say, we listen, we don't judge. That's normally very big for them. So has it happened? Yes. A border person, these are people who are in the gig economy, who has an acute challenge, an acute healthcare challenge. But because of the geographical distance and also cost, they end up suspending access to a healthcare service until the issue becomes chronic. Now, does your product or your technology provide that access immediately? I can be able to speak to a healthcare service provider in a tap of a button or just on a phone call. That means you have alleviated that chronic ailment from moving from acute to chronic. It may be something as small, but eventually, because lack of access to service provision, becomes chronic. So you have done something that's very critical. A mother who relies on hearsay, absence of information, people rely on words of what they hear. If your platform provides that, that means they can be able to speak to a certified health service provider. You have helped them a big time. So trust, dignity, and access, critical for Klinik as we build and we deploy in this market where we operate in. Yep.
I think that there's a lot of commonality between what you are doing there in Kenya, and also there are a lot of people who have been doing here in Pakistan, countries like Pakistan. So I see a lot of commonalities and a lot of work that we've been, people who have been looking at how the healthcare, human dignity, and resource and access to information, especially right information. So your work is, I would also like to know about the use of AI in building up this important platform, and how can this digital health solutions can avoid inequality, while you're also looking at AI is transforming the entire process and entire systems. Here, when I'm asking you a question, because it is important, because as we are gearing up for our Global Future Summit, where Dr. Philip and many other colleagues from across the world will be talking about how AI and the solutions are provided through use of AI. And there will be few more discussions about it. And I will encourage those people who are listening to us right now, they should register for this important summit and conversation, as we will be hearing Stephen as well there in the summit, discussions about how AI is helping you in your daily work and giving the access to information to the people around?
So thanks. One thing I always say, AI is not coming to replace reality, but to augment reality. So as Klinik, when we are building any model that we build, we have that at the back of our mind. We're not coming to replace the reality. We're not coming to replace the doctor. We're not coming to replace any reciprocatory information that's always there, but we are coming to augment, make it more accessible, make it faster, just to speed, ease of access, and things of the sort. How do we make the reality framework more friendly and more accessible to a larger population at a scale level? So that's where AI comes in. And also one thing that also is critical as we are building this model, also understand the constraint that you're building into. And to us, that's very good. In Africa, in Kenya, there are so many constraints. And they always say people innovate around constraint. With the time, they will find nature abhors vacuum. And they always say so. So for instance, if there are technology gaps, for instance, penetration of internet is a challenge. Use SMS, you can use USSD, you can use WhatsApp. If, like for instance, Klinik, we have deployed a lot of use of SMS and WhatsApp. People have internet access. For people who have feature phones, we use a lot of voice consultation, because we know as long as you have access to a phone, whether it's a smartphone or a feature phone, you can be able to talk to a healthcare service provider in a jiffy. So you building your AI on the back of it, so that we use the voice recognition technology to be able to do the summary and be able to build a notification that can be sent to you via SMS frequently to either notify you, remind you, or also keep you update on your challenge or your element or what's coming up new, or your if you have a session coming up next. So those notifications coming through. So AI is just helping augment or help the reality of thing. Also, what's also interesting, also the reason why also people don't have a challenge in the healthcare, also affordability, the cost element of it. So how do we ensure that we can be able to build, and that's why AI comes in, we can be able to get a lot of data points from you and build a credit score that we can be able to provide micropayments, because instead of lump sum payment, because based on the economic accessibility of funds, most people cannot afford lump sum payment. But if you provide micropayment, it means it's more affordable to them and they can be able to access. Also, some services subsidize them. Use AI to be able to leverage and provide a lot of information, so that now you can subsidize. So if a service in normal session will cost, like, let's say $5, by use of technology, that means you have cut a lot of overheads. Now you can provide it at, let's say, $3, which is more affordable and accessible to a larger population, especially people living in the rural area or in the slum areas if it's in the outway. So that's critical. The last bit of it before you come in is the last mile relational. So for us as Klinik, what we've done, we have known there is a people behavior where they're unwell, they don't go to the hospital first, but they go to your local pharmacy, what you call the neighborhood pharmacy, your mom pops shop, quote unquote. That's where they go seek healthcare first. So what we've done, we've converted those pharmacies to be our agents who onboard them onto our platform, because that they trust them. So if they provide them our technology, there's less resistance, and people now, we've seen a lot of spike in terms of onboarding from those physical pharmacies, because pharmacy will get two things. Apart from them onboarding you, which they get a commission, they will also fulfill the drug that has been prescribed by the doctors on the platform. So they're getting two revenue channels. So that means we're enabling to send online, which if we weren't there, they wouldn't have made those sales. So that's how we use AI to be able to adapt and be able to bring all these components of people together, so that all of them enjoy the benefit of technology. Yeah.
Tremendous work, Stephen. I mean, it is just you're giving a solution to things which were there for so long, and using of AI and technology has resolved many of issues. I hope that your work is globally recognized, and as we are recognizing you, you are also invited to the Global Future Summit by our regional director from Africa, and you will be sharing a lot of this huge stage with I mean, people from across the world. So, I mean, when we are discussing about the Global Future Summit, which unites nearly 20 plus countries and across the world, this simultaneously this summit will be happening and shared by the people. As a speaker, what message that you're bringing to the table, and what are the insights and voices that, especially the African continent, your voice matters more, and what are the various subjects, and what are your thoughts on bringing forward especially AI and digital health related matters? And I would really like to know, because there are many colleagues who might be listening to your interview, they might be interested to know that what kind of what are the various messages or thoughts that you're bringing for the Global Future Summit that is happening in coming days.
Thanks. There's something I want to highlight, which is very critical, especially in this part of the world, Africa, where we live in. What the global players often overlook, and it's very critical. Africa, people adapt because adaptation is born out of constraint. If you live in an environment where there's a lot of constraint, what happens? You become adaptable. So one thing that is very critical is whenever you're coming to this side of the world, when you're building or you're bringing technology, yes, there is the big hype about the youth population. There's a big hype about Africa becoming the next player in the workforce because of the burgeoning population compared to other continents. But one thing you'll understand, which is critical, is that people in Africa are more resilient. They are more user anchored rather than technology anchored. User anchored. So that means if your technology doesn't conform to the behavior that they are used to, adaptation becomes, or adoption becomes a challenge. Once also, it's important also, how do you price your technology or your solution? Because they're cost sensitive. Remember, they live in a constrained environment. And what's also important is all those innovations. So Africa will be able to build what we call a prototype playbook. I always call it that way, because in Africa, the technology is not built in corporate boardrooms, it's built in the field and then adopted in the corporate boardroom.
So true, yes. Yes, so true. I mean, Stephen, you actually speaking from the heart, because you are the builder who has built not only technology, use of the technology, but you are there in the ground from the very heart of the problems that are there, but also at very heart of finding the solution. So, Stephen, one of the things that I really like to ask you while we are coming to closer to our conversation is that for the next 3 to 5 years, where you see the healthcare accessibility going in Africa? And do you see that the collaboration from the governments, investors, or innovators, they're coming together to achieve that accessibility, or how you see that? I mean,
thanks. And if you couldn't have that question, I would be offended, because what is happening now, the governments in Africa are waking up. They are realizing they need to leverage technology to reduce the constraint they have been experiencing for long. Stockouts, lack of drugs, and also just human capital spread in the. They always say, if you look at stats, I think WHO, Africa accounts for only 2% of the world doctors' population. Yet 80% of non-communicable diseases are resting in this continent. Now, what the governments are doing, I'll give an example of Kenya. There are policies that are now being brought forward that are forward-looking. Kenya has a digital health policy, which governs issues of telemedicine and use of technology. Kenya is bringing what we call interoperability between key players in the healthcare environment, so that your data can be shared within the ecosystem. So those are just basic examples of how government is now forward thinking, because most governments in Africa are now coming what we call universal healthcare framework. And for you to be able to succeed in the UHC framework, technology plays a big role. Telehealth become the anchoring entity. And for you to have that, infrastructure has to be well taken care of. Cybersecurity laws has to be very well done so that the data is well protected, and just the whole framework. So in the next 5 years, I'm seeing, especially Sub-Saharan Africa and part of West Africa, I'm seeing a lot of digital health framework coming on board and government adopting a lot. And to me, that's a good news to my ears. Yeah.
Thank you, Stephen. And one important message that you would like to share with us to our viewers who are watching, especially the young people who are building their dreams, who are finding solutions and finding the ways into their life journey. What is the message that you would like to give to them, especially coming from someone who has really plowed the field? And I would really like to have that message for the people.
For the young guy, young girl in college building something in their cubicle, in the dormitory and the likes, the road has been plowed. The road is now, more bottlenecks have been, we've taken care of most of bottlenecks. The road ahead is a clean canvas for you to write your play. Please do not give up, push in, deploy that solution you're trying to build. As long as you understand it's solving a particular pain point in the market, the market is big, let me put it that way, and it's growing. And adaptation of technology is increasing. So that means you're in the right position, right framework of play, and in the right time for you to be able to enjoy the fruits of your labor eventually. So don't give up, keep it on.
Thank you so much. This was Stephen Dimba, who has made a remarkable progress then in Africa, providing solutions to those who have less access to healthcare, especially, and building his clinic, his projects, his ideas, and inspiration. And coming from a humble background, if he can do it, everybody else can do it as well. So, ladies and gentlemen, my friends, fellow colleagues, young people who are listening to us right now, we are gearing up for our Global Future Summit. Stephen will be speaking on the Future Summit. He will be sharing more insights about his healthcare, how AI is supporting those initiatives. Always remember that change. We get scared of change sometimes, but change is always leads to progress, prosperity. It gives us more insights. It gives us always a progress that we all living for and looking for. So see you all on Global Future Summit. If you have not registered it yet, we'll be sharing the link of the registration under this interview series. You can witness this. You can see this on our YouTube channels, both SILKROAD 4.0, Diplo TV. Thank you so much. This is Dr. Farhat Asif. I am speaking to you on behalf of our friends, colleagues from SILKROAD 4.0 and the Diplomatic Inside. See you then. Thank you so much.